Hi there. Have you heard about Respond? It's coming to your hospital and your unit very soon. I'm Peter McCulloch. I'm a consultant surgeon and a professor of surgery at the Nuffield department in Oxford. And I'm leading this national programme which is funded by £2.5 million of money from the National Institute for Health Research. The aim of the programme is to improve our systems for rescuing patients after complications develop from surgery. Your trust is one of the 3 pilot sites where we're going to focus on the surgical emergency unit and use them to refine, test and develop the interventions. Why are we doing this? Well, emergency laparotomy is still the riskiest operation we do in the NHS, with an average mortality of around 10%. We know that some of the traditional NHS systems for rescuing patients after complications have their flaws, and we believe that by taking a human factors approach, we can streamline and improve our systems and improve our results. We can't provide extra resources 24/7, but we believe we can do a better job with the resources we have. We've been listening to you about what's happening at the moment and discussing possible improvements with you for about 18 months now. And we've developed an intervention program that has 4 strands. So strand number 1 is going to be a system for involving patients in alerting staff to deteriorating patients. And strand 2 is going to be about using a human factors approach to streamline the system and get help faster and more easily. Strand 3 is going to be about team strengthening, aiming to improve morale after COVID and to improve the climate at work and the way in which people work together in teams. And strand 4 is going to be about improving the interaction between the surgeons and the other departments in the hospital that are needed when a patient gets really ill. The programme will last a year, and the first 3 months will be run as a quality improvement process using PDSA cycles to refine the interventions. What will this mean for you? Well, it'll be the same work, but we may ask you to do something slightly differently. We'll be using this new system for involving patients, but also a new system for junior surgical staff to present cases on the phone to other departments. We'll be looking to you to develop and maintain the sets of rules and values that you decide on at the start of the programme to strengthen your teams. And we'll be developing simulated multidisciplinary emergency scenarios, which we'll ask you to join in with. We'll have social events at regular intervals and a games league, which will involve doctors and nurses and members from other departments. This is really a chance to make things better for you and for your patients, and to get involved with service improvement and research. One of the key elements of the launch of this programme is going to be the away days, and we want everybody there if possible, both doctors and nurses. We're going to start each of these with some games and then an opportunity to socialise with friends and colleagues. We'll have some food and then we'll move on to some small group discussions of team values and the way we'd like to work together. Each of the sessions actually only lasts about 3 hours, and we can show you the dates and times and venues of these on our website, which you can look up here. We'll be presenting vouchers and certificates for attendees, and if you'd like to come but have a practical problem, please get in touch with us at respond@nds.ox.ac.uk. We'll do our best to help. But please come along and help us to help you make things better for emergency surgical patients. Thank you.